National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Jonathan Beatty, naturopathic doctor and a health expert here at Nationalnutrition.ca. Today I want to tackle a very controversial topic, which is cholesterol. Now, it's something that I feel, in my personal opinion, has gotten completely overblown as a marker of heart disease. And it's actually, to me, probably one of the most misunderstood areas in medicine. Because, of course, people are all focused on lowering their cholesterol and not really looking at what an elevation in cholesterol actually means. So first, let's try and understand what cholesterol is. So cholesterol is essentially, it's a fatty molecule in our body, and it's transported in what we call LDL or HDL or VLDL. And what these things are is what we call lipoproteins. So it's proteins bound to cholesterol. So when we discuss these things like LDL, let's keep in mind that it's not actually cholesterol we're discussing. What we're discussing are cholesterol transport proteins, or cholesterol transporters in the body. And if you have elevations in LDL, which is your low density lipoproteins, what's happening is your body is manufacturing cholesterol and trying to ship it to an area of the body that needs the cholesterol in order to heal. And if your body is manufacturing a lot of HDL, or high density lipoprotein, what your body is actually doing at this stage is it's taking cholesterol from somewhere else in the body and returning it back to the liver, where that cholesterol might get processed into some other molecule, or it could get repackaged into an LDL for redistribution somewhere else. So when we look at cholesterol, lowering somebody's cholesterol artificially, what you're doing is you're not actually changing their risk of mortality. That's something that, if you look at the research, you don't see a great life-saving ability of cholesterol-lowering medications. And the reason behind that is you're not actually getting rid of the inflammation that's causing the elevated cholesterol in the first place. And so in order to help manage cholesterol, what we really want to be looking at is what's creating the inflammation that causes the cholesterol in the first place. Cholesterol is a very important molecule. It is the basis for all of your steroid hormones. So your estrogen, progesterone, and testosterone, they're all produced from cholesterol. In fact, 25% of your brain is actually made up of cholesterol. It's very, very, very important. It's the precursor molecule to vitamin D. Your body makes vitamin D. It basically takes cholesterol, puts it up in your skin where it's reacted with radiation from the sun to form the compound vitamin D. So this is why cholesterol is so important to your health, and artificially lowering it can actually, potentially induce other problems. So, looking at cholesterol, if you have elevations in cholesterol, what you really want to be focused on is that underlying inflammation. So there's a number of things that have been shown to greatly reduce cholesterol and also help reduce mortality. So things you want to be focused on: fish oils, very, very effective at helping to manage cholesterol. It's been studied over and over and over again. You want about 5 grams a day of omega-3 fatty acids from fish, especially high in EPA and DHA, in order to help lower those cholesterol levels. Additionally, you would want to supplement probably with some niacin. Niacin's been very well studied to help lower cholesterol levels as well. And you could also look at adding in an anti-inflammatory supplement along the lines something like curcumin or turmeric. Very, very effective. Best if fermented. You'll actually get slightly higher bioavailability and better activation of the active compounds in the curcumin if you can get a fermented source. Very, very helpful in managing inflammation. And again, if you have things like arthritis, that's inflammation. It could be your arthritis that's actually leading to that gradual elevation in your cholesterol over time. So again, let's make sure we're focused on why the cholesterol is elevated in the first place. Work on treating that, and you can avoid having to go on medications for life in order to just artificially lower your cholesterol. So I hope this has helped you understand a little bit about cholesterol and taught you some things you can do to help manage your cholesterol on your own. If you have any questions or comments, please post them below. Subscribe to our YouTube channel, and always remember that knowledge is health.